Hello, greetings and good evening to all of you to be here once again. So I would like to welcome to all of you. मैं सुनील यादव आप सभी लोगों का वेलकम करता हूं. Am I audible now? I think my voice is clear.
Yes, Sunil.
Okay, thank you. So I would like to welcome you to all the beautiful guys over here. आप लोगों का सभी का वेलकम है आज के इस वेबिनार में. मैं सुनील यादव. I'm from New Delhi. And I'm here in this industry since 18 year back. And मैं एक wellness trainer हूँ और इस इंडस्ट्री के अंदर एक लंबे समय काम करते हुए और आज जहां पर हम जेनेटिक के बारे में चर्चा करना चाहते हैं और इसके बारे में जानेंगे कि इंडिया के अंदर ये इतना बड़ा एक रिवॉल्यूशन जो आया है इसके पीछे क्या रीजन है और कितना बड़ा करियर माइलस्टोन आगे खड़ा होने वाला है. तो उसके बारे में जानने के लिए आज हम जो चर्चा करेंगे उससे पहले मैं आप सभी लोगों से एक रिक्वेस्ट करना चाहूंगा. ये बहुत इंपॉर्टेंट है क्योंकि आप लोगों का समय बहुत कीमती है, आप लोगों ने समय निकाला है. तो आई वुड रिक्वेस्ट यू टू ऑल ऑफ यू, सबसे पहले तो आप लोग अपने मोबाइल फोन को साइलेंट कर सकते हैं और बाकी लोग जिन लोगों ने अपने वीडियो को ओपन नहीं किया है, आप लोग अगर अपने वीडियो कैमरा को ओपन कर लेते हैं तो आई एम डैम श्योर जब हम वीडियो को ओपन करके बैठते हैं तो हम लोगों का अटेंशन बहुत अच्छा रहता है. जो आई टू आई में कांटेक्ट होता है वो हमेशा अफर्मेशन की पावर को बढ़ाता है. बिकॉज यू ऑल आर गिवन योर वंडरफुल टाइम एंड प्रीशियस टाइम. सो आई वुड रिक्वेस्ट यू टू ऑल ऑफ यू अगेन, आप लोग वीडियो को ऑन करके रखें. 1 घंटे के लिए हार्डली 40 to 45 मिनट के लिए आप लोग अटेंशन करके रखें क्योंकि आप लोगों का टाइम यूटिलाइज हो पाए. नंबर 2, आप लोग जितने भी समटाइम हम लोग कई बार घर पे होते हैं रिलैक्स जोन में, तो कई बार रिलैक्स जोन में होते हुए बेड पे लेटे होते हैं. तो आई वुड रिक्वेस्ट यू टू ऑल ऑफ यू काइंडली गेट सिट डाउन. आप लोग सीधे स्ट्रेट बैठे और अपनी जो स्पाइनल कॉर्ड है उसको स्ट्रेट करके रखिएगा क्योंकि जब आप स्ट्रेट बैठते हैं तो आपके जितने भी चक्रास होते हैं वो सारे के सारे एक्टिव मोड में होते हैं और अफर्मेशन बहुत तेजी से जाती है जो भी चीजें आप पढ़ते हैं या स्टडी करते हैं. So you must be in affirmation so that you will learn everything whatever the purpose over here today. So for that it is little my request once again, आप लोगों को सभी को फिर से रिक्वेस्ट है काइंडली स्टे स्ट्रेट एंड आप लेग या हाथों को क्रॉस करके नहीं बैठेंगे क्योंकि जो भी अफर्मेशंस आएंगी, जो भी नॉलेज थॉट प्रोसेस है वो आप लोगों को ठीक से एक्सेप्ट मोड में जाएगा. सो आप लोग क्रॉस नहीं करेंगे लेग को या बाजुओं को. सो इट इज अ प्रोटोकॉल लिटिल बिट. ओके, सो आज का जो चैप्टर है, जैसे कि आप लोग जानते हैं कि कोविड के बाद या पैंडेमिक सिचुएशन के बाद में किस तरह से लोगों ने एक्सेप्ट करना शुरू कर दिया प्रिवेंटिव इज बेटर देन क्योर. तो प्रिवेंशन की तरफ वर्ड कैसे जा रहा है और आफ्टर कोविड ये जो एक इतना बड़ा रेवोल्यूशन क्रिएट होने के लिए जा रहा है कि आने वाले कल में ऑलरेडी गवर्नमेंट ऑफ इंडिया में कई लैब को सेटअप कर दिया. आने वाले कल में जो इतना बड़ा फ्यूचर हेल्थ को लेके, प्रिवेंटिव हेल्थ को लेके खड़ा होने जा रहा है. तो हम में से बहुत सारे ऐसे लोग हैं जो कि स्पेशली अपनी हेल्थ को लेके जिन्होंने अपने जेनेटिक टेस्ट को कराया भी है और जिन लोगों ने नहीं कराया है, तो आज के इस वेबिनार को लेने के बाद आई एम डैम श्योर कि हम अपनों की जरूर सुरक्षा कर पाएंगे और लोगों को कन्वे कर पाएंगे कि जेनेटिक टेस्ट क्यों ज़रूरी है हमारी लाइफ को आने वाले कल से जितने भी आने वाले कल में जो बीमारियां होने वाली हैं उनसे बचाने के लिए. तो आज के हमारे इस पैनल में हम लोग वी आर रियली वेरी हैप्पी एंड लकी टू बी हियर टुडे वंस अगेन. तो हमारे आज के जो पैनल में जो कि जेनेटिक की दुनिया को लेके, जैसा कि आमतौर पे हम लोग बोलते चले आए हैं, जेनेटिक की दुनिया में आज हिंदुस्तान के अंदर जो बायो इन्फॉर्मेशन को लेके जो चैप्टर क्रिएट किया है वो एक नाम अछूता नहीं है. सो आई वुड लाइक टू इंट्रोड्यूस टू ऑल ऑफ यू अबाउट मिस्टर स्टैन सराव, जो कि CMD एंड मैनेजिंग डायरेक्टर ऑफ वेलोसिटी जेनेटिक्स हमारे बीच में है. सो आई वुड लाइक टू वेलकम टू मिस्टर स्टैन सराव सर. एंड सेकेंड नाम आता है रिद्धि शाह, जो कि आज हमारे बीच में आई एम हियर. वी ऑल आर ऑलमोस्ट बहुत सारे ऐसे लोग हैं जो कि हम लोग फर्स्ट टाइम उनको सुन रहे होंगे और वो ऑलरेडी वेलोसिटी जेनेटिक्स के साथ में सी स्पेंड अ लॉन्ग टाइम एज अ कंसल्टेंट, एज अ न्यूट्रिनिस्ट एंड सी सर्टिफाइड nutrigenomic consultant. So she served a lot of wonderful reports to all of us. So I would like to welcome to Riddhi Shah also over here in this beautiful webinar today. Thank you very much. And once again to all the beautiful wonderful guests today, जिन लोगों ने आज फर्स्ट टाइम इस वेबिनार को अटेंड किया है, आप सभी लोगों का मैं हार्दिक स्वागत करता हूं. So kindly be stay over here and I would request to Stan Sarao sir kindly proceed for further. Thank you very much.
थैंक यू सुनील, बहुत बहुत धन्यवाद आपका। बहुत मेथोडिकल इंट्रोडक्शन आपने दे दिया। सो गुड इवनिंग एवरीबॉडी, आप सभी लोगों का हार्दिक स्वागत है इस वेबिनार में। सो वेलोसिटी जेनेटिक्स और वेलोसिटी बूस्टर की तरफ से दिस वेबिनार इज बीइंग ऑर्गेनाइज्ड टू अंडरस्टैंड कि जेनोमिक वेलनेस हमारे लिए क्यों जरूरत है, इसमें क्या बेनिफिट्स है और क्या ऐसी चीजें हैं, क्या ऐसे इंसाइट्स हैं जिसको हम लोग जब समझते हैं उसमें बहुत सारे फायदे हैं। हम लोगों ने वेबिनार के पहले 2 वीडियो प्ले किए थे। वन ऑफ कोर्स टॉक्स अबाउट कि हाउ वेरियस फूड्स दैट वी आर टेकिंग is having a lot of impact on our health, including our brain health. So there are specific foods that we can take to also get rid of our sadness, disappointment or depression. So this is possible. And हमारे जो experts हैं, nutrigenomic counselors हैं, and nutritionists हैं, they're all postgraduate, well qualified, highly experienced with interaction with a lot of people across India and also in some parts of the world. They actually guide us कि आप छोटे छोटे चेंजेस अपने लाइफ में, आपके फूड डाइटरी इंटरवेंशंस में और आपके लाइफस्टाइल में करके किस तरीके से अच्छी सेहत की चाबी जो आपके पास है उसको आप यूज कर सकते हैं, और जो बीमारियों का जो ताला हम लोगों ने लगाया हुआ है उसको हम लोग कैसे खोल सकते हैं। So firstly I would like to gladly welcome Riddhi Shah on this I would say a little bit of talk show or a panel discussion. Riddhi, warm welcome to you.
Thank you, sir. Thank you so much for having me here.
So Riddhi has been a part of Velocity Genetics for the last 4 years, 4.5 years. She has done counseling of more than 1,500 people from all sections of the society. And importantly, she also is in a faculty of a certificate course in nutrigenomics. So हमारा जो अभी 5th batch चल रहा है, she also is one of the faculty, and then she's teaching people. And the best thing about her is that recently during lockdown she has been also been able to achieve post graduation in yoga. So congratulations to you, Riddhi.
Thank you, sir. Thank you so much.
So coming to the subject कि genomic wellness क्यों जरूरत है और इसकी क्या अहमियत है, तो उसके पहले I would like to just run through a little slides that I want to show you about जो वेलोसिटी जेनेटिक्स का जो हम लोग जेनेटिक टेस्टिंग करते हैं, लॉट ऑफ पीपल फील कि ये टेस्ट में क्या ऐसा छुपा हुआ है। तो आज के सेशन में जस्ट रन थ्रू अ फ्यू स्लाइड्स एंड देन द सो कॉल्ड फिनोटाइप्स। हम लोग ब्लड टेस्ट में इसको पैरामीटर्स बोलते हैं कि भाई कितने पैरामीटर्स आप चेक करते हैं, वेदर इट्स लिपिड, हीमोग्लोबिन एंड सो मेनी अदर थिंग्स। सो यहाँ पर देयर आर द टर्मिनोलॉजी जो हम लोग यूज करते हैं दैट इज कॉल्ड फिनोटाइप्स। सिंपल लेमैन लैंग्वेज में अगर हम लोग इसकी बात करें, फिनोटाइप्स मतलब जो बाहर हमको दिखता है या सिम्टम्स है या एक्सप्रेस होता है। अब ये एक्सप्रेस होने के लिए कुछ ना कुछ तो वजह रहेगी, कुछ ना कुछ रीजन रहेगा या कुछ उसका रूट कॉज रहेगा। तो रूट कॉज अगर जेनेटिक लेवल में इसको हम लोग एक्सप्लेन करें, एक आम भाषा में इसको बोल सकते हैं दैट इज कॉल्ड योर जीनोटाइप। तो मतलब आपका फिनोटाइप क्या है वो आपके जीनोटाइप के ऊपर निर्भर है। So what we do is we have around 18 different panels in a comprehensive genetic testing. So the first one is nutritional deficiency risk. अगर आप में से कोई भी या आपके परिवार में से कोई भी डॉक्टर के पास जाते हैं, आई एम श्योर मोस्ट ऑफ द डॉक्टर्स टुडे राइट 2 ब्लड टेस्ट एसेंशियली सब लोगों को करते हैं, विटामिन B12 एंड विटामिन D3 कि इसकी कमी आज इंडिया के 80-90% लोगों में पाई जाती है बिकॉज ऑफ हमारी लाइफस्टाइल बहुत ज्यादा चेंज हो गई है, आवर डाइटरी हैबिट्स आर कंप्लीटली चेंज, अपना स्लीप पैटर्न्स चेंज हुए हैं। सो लॉट ऑफ थिंग्स हैव चेंज्ड, so that is why we have a lot of changes. So first thing that we check here हमारे जो पैनल में है न्यूट्रिशनल डेफिशिएंसी। तो कई बार हम लोग थोड़ा लूज लैंग्वेज में, आम लैंग्वेज में बोलते हैं कि भाई ताकत की कमी है, शरीर में ऊर्जा नहीं है, एंथुजियाज्म नहीं है, कई डिसअपॉइंटमेंट, डिप्रेशन है। दिस इज बिकॉज ऑफ डेफिशिएंसी ऑफ अ लॉट ऑफ न्यूट्रिएंट्स। क्योंकि आज हम लोग टेस्ट के लिए, स्टेटस के लिए या मतलब सब लोग खाते हैं इसके लिए बहुत सारा जंक फूड कलरफुल विजुअल ट्रीट है, मतलब जैसे डोनट आप देखोगे उसमें हर तरीके का डिजाइन आता है, केक्स देखोगे आई थिंक यू विल गेट ऑल काइंड ऑफ प्रिंटेड फोटोग्राफ्स ऑन इट, तो विजुअल ट्रीट है उसको हम लोग खा लेते हैं, but then whether it will have adequate nutrition to our body so that every organ, every tissue, every cell of our body can function to this optimum level, ये हम लोग इतना ध्यान में नहीं रखते हैं. So we have to look at कि what every food that we consume is having this deficiency, मतलब उसमें ये अंश है या नहीं है, अगर है भी क्या हमारी बॉडी इसको adequately metabolize करने के लिए, प्रोसेस करने के लिए सक्षम है या नहीं है, is also something that we need to do. So we do around 24 tests in the nutritional deficiency risk कि आपको genetically क्या metabolism में और deficiency में problems हैं. One of the very, very popular segment that we have is called the food intolerances and also allergies. तो आज कई सारे लोगों को, हमारे ऑफिस में बहुत सारे लोग आते हैं, बोलते हैं मैं कैरेट खाता हूं तो मुझे रैशेस आते हैं, कोई बोलते हैं कि मुझे बीटरूट खाता हूं तो मुझे पूरा शरीर में स्क्रैच करने जैसा होता है. सो लॉट ऑफ पीपल हैव डिफरेंट काइंड्स ऑफ फूड एलर्जीज, बट व्हाट स्लाइटली डिफरेंट इज फूड इंटॉलरेंसेस. इंटॉलरेंसेस आपको इमीडिएटली असर नहीं करते. आपने सुना है लोग पार्टी में जाते हैं या कहीं बाहर खाना खाते हैं तो उनको फूड पॉइजन हो जाता है, तो फूड पॉइजनिंग हो जाता है तो दे विल हैव अ लॉट ऑफ सिम्टम्स लाइक लूज मोशंस एंड डिसेंट्री एंड दिस काइंड ऑफ इमीडिएट रिएक्शंस. But food intolerance is not something that will be expressing themselves immediately. So we have 3 major food intolerances, जिसमें gluten है, caffeine है and lactose है. So they will take years to express themselves. So तब तक internally बहुत सारा damage होता है and unknowingly we will do this. So today we will also see a case कि जहां पर फूड इंटॉलरेंस से लोगों को क्या तकलीफ होती थी, क्या दवा करते थे, तो हमारे डीएनए टेस्ट के बाद में उनको क्या हम लोगों ने इंसाइट दिया और उनको क्या सॉल्यूशंस दिया और वो सॉल्यूशंस में से उनको क्या राहत मिली. इट्स अ वेरी सिंपल फिक्सिंग ऑफ दैट पर्टिकुलर प्रॉब्लम, तो वो भी हम लोग देखेंगे. सो वी गॉट अ इंपॉर्टेंट कैटेगरी हियर. देन वी आल्सो हैव डर्मेटोलॉजी. वी अंडरस्टैंड दैट स्किन इज द लार्जेस्ट ऑर्गन दैट वी हैव, तो सबको बाहर से दिखता है. आई थिंक एक जमाना था वेयर पीपल यूज्ड टू यूज वन सोप while taking bath, so they will apply the same soap for your head, on your face and for your entire body. But today personal care has so much advanced that you can't use a bath soap to your hair, so you've got shampoos. अब शैम्पू से भी काम नहीं चलेगा, उसमें भी अलग अलग तरीके के शैम्पूज हैं. You have conditioners. And face के लिए you have a face wash and so many other things, so all kinds of creams. So we have advanced, but हमारे शरीर के अंदर जो चीजें जा रही हैं उसमें भी हमको तब्दीली करनी पड़ेगी because वो भी काफी चेंज हुए. तो डर्मेटोलॉजी को लेके बहुत सारे चीजें हैं. there are so many diseases that we get. It could be eczema, psoriasis and vitiligo, these kind of things. So let's also have a look at that and then probably we'll also be able to dwell into that. Weight management, the first thing that जो हमारे जहन में आता है कि जब weight management करेंगे तो मतलब lose weight, because obviously most of the people are overweight. BMI हमारी ज्यादा होती है. Today we'll also explain a case where a child was not able to put on weight and then we also help and solve that problem and gave them solutions with change in the diet plan. So diabetes, इसके बारे में कम बात करूं तो अच्छा है because we all of us understand, हम लोग over information इसके बारे में हमको मिला है. So we have this phenotype. So you can see 18 different phenotypes. डायबिटीज के लिए अलग अलग रीजंस हो सकते हैं. इट्स नॉट अ मोनोजेनिक कंडीशन कि भाई ये रीजन से डायबिटिक होता है. इट कुड बी मल्टीपल कंडीशंस, तो उसको भी हम लोग समझेंगे टुडे. एंड वी आल्सो वुड हैव थायराइड हेल्थ. मोस्ट ऑफ द टाइम आप सभी लोगों को पता है कि विटामिन ए डिफिशियंसी थायराइड पेशेंट्स में ज्यादा पाई जाती है. सो लेट्स आल्सो अंडरस्टैंड that there's one gene, and I came across a very important study that was done in 2009 in India. That's a paper that's published. तो उसमें if you have a particular genetic mutation, and the risk factor in India is that 1 out of 8 people, so that's almost around 12-13% or even 15% of the population have this risk that if you have that genetic mutation, that leads to cardiac myopathy, which is ultimately leads to sudden cardiac arrest. अब ये sudden cardiac arrest आने का risk है, Now you see that कि अभी हमारे सोसाइटी में बहुत सारे ऐसे लोग हैं जिनकी अचानक कार्डियक अरेस्ट से मृत्यु हो जाती है, and people take it as a very normal reason of death because the cardiac arrest or heart related ailments today are the #1 killers. Though we heard Dr. B.M. Hegde speaking in his video that it's the Edwards drug reaction. And I'm sure cardiac health wale patient definitely go to the patient and they get treatment, and it could be out of anxiety, out of so many things. It could be multiple types of treatment because everybody wants to get into stents and pacemakers and bypass surgery, etc. Now we see a lot of people, a lot of doctors, including doctors who worked in the AIIMS at Delhi, have come out and then said, look, don't need a bypass. There are methods with which you can attend your issue with non-surgery as well. So ये सभी लोग चीजों को समझना जरूरी है because we can't be blindly over depending on the medical infrastructure which thoroughly got exposed. I really appreciate Mr. G.R. Krishna's reaction when B.M. Hegde says that psychiatrists are the people who are like creating a lot of dementia related issues. Yesterday I was actually speaking to a doctor who visited our office, and then he said he himself is a homeopath doctor, but then he says I have developed this condition of dementia. Now that also could be one of the adverse reaction of various medications that we're taking. So then, of course, there are so many other organ conditions that we have today. So that also is something that we got to be taking care. CKD is again a very, very popularly or rather unfortunately fast-growing condition. Inflammatory को काफी गलत तरीके से शायद present किया जाता है. It's equated with pain, but there's a vast difference between inflammation and pain. So a pain management mechanism could be entirely different from how we need to really understand inflammation from a diagnostic perspective. तो इसको समझना जरूरी है. So अलग-अलग अपने vernacular languages में इसके proper words हैं जिसमें आप समझ सकते हैं कि एक तरीके की जलन है body की. It actually alerts you saying that there's something wrong, so you better pay attention. So it's an alert system. And then of course there are so many neurological health, and I'm sure post-COVID, post-lockdown, I think people are facing a lot of issues which are neurological. It can also lead to arthritis conditions, or it could be migraine, could be Alzheimer's or autism, and then you name it. So these we are checking around 25 different phenotypes to assess the genetic risk and then possibly find out solutions. And of course, who doesn't really understand that today, we need to really master the science and art of eating right. We can't be just eating for the heck of mitigating our hunger, or just for the heck of being socially relevant and then eating foods that please others but not your body. So ये हमको समझना जरूरी है. So you just need to know the art of eating right, but also the science of eating right, and that's exactly what we try to give through Velocity Genetics DNA testing program. And then of course there are some gender specific risks as well. Biological aging is now something that people are really worried about. Anti-aging industry is the billion-dollar industry क्योंकि उसमें बहुत सारे ज़्यादा solutions हैं. Everybody wants to be biologically looking younger, and of course we also enter into a very interesting field of pharmacology. So pharmacology में आप YouTube में videos देख लीजिए. So there's a lot of misrepresentation of the drugs and medicines that have been prescribed, and then you heard just Dr. B.M. Hegde was saying exactly the same thing. कि symptoms बताने के पहले prescription चालू करते हैं because people don't really have, or the medical fraternity don't have patience to listen to the symptoms and really get into research and study. So this is also something that we do. And then of course a lot of class of medicine including metformin, statins, warfarins, pioglitazone. So ये class of medicines है, वो अलग-अलग pharma company अलग-अलग brand name में manufacture करके बेचते हैं, उसका दाम भी अलग है. But it's very, very important. Pharmacology में your age, your current health conditions, आपकी allergy or reactions, your dosage, your duration, a lot of factors matter. तो कई बार हम लोग सेल्फ प्रिस्क्रिप्शन भी करते हैं कि हाँ 2 साल पहले मुझे बुखार आया था या कोई कंडीशन था उसके लिए ये दवा किया था, तो अभी 2 साल के बाद में भी हम लोग वही ले लेंगे. So that's self prescription. And there's also peer level prescription where मेरे लिए जो दवा मैंने डॉक्टर से लिखवा के लिया था, which helped me, we also suggest to our friends and relatives, and then to save the consultation charges. So ये भी है. Then of course very important is fitness and injury risk. We all believe that fitness is all about going to the gym and hitting those weights or cardio machines. It's not really that. It's 70% of your diets and then 30% the physical activities, so that your body tones up, it's in shape, and you shed all the fat, extra fat that you have. So ये सब कर लेते हैं. Of course सर्केडियन रिदम के बारे में वेलोसिटी जेनेटिक्स में हम लोगों ने बहुत ज्यादा चर्चा की हुई है. एंड वी नीड टू रियली अंडरस्टैंड कि हमारे शरीर के अंदर जो एक बायोलॉजिकल क्लॉक है, एक घड़ी जो है, इट एक्चुअली प्रॉम्प्ट्स यू कि किस टाइम पे आपको क्या काम कर देना चाहिए, बेस्ड ऑन अ लॉट ऑफ हार्मोनल एंजाइम सिक्रीशन दैट हैपेंस. तो अगर उसके विपरीत हम लोग चले जाएंगे, लेट्स टेक एन एग्जांपल ऑफ बीपीओ इंडस्ट्री और द कॉल सेंटर इंडस्ट्री, which is working in a different time zone during your biologically conducive time of sleeping. आपको सोना चाहिए, but then you're working because you probably have paid a little more, or probably there is less employment opportunities, so you settle for a job. तो ये सब करने के लिए जब हम लोग biological clock के against जाते हैं, so then of course we have some hormonal disintegration that's happening in our body, and that is creating a lot of symptoms. So whether it is irregular menstruation or infertility in women is found, and conditions like PCOS. So ये भी conditions हैं जो हम लोग अभी बहुत अधिक प्रमाण में हमको देखने के लिए मिलता है. And of course last is the immunology. So immunology, genomics. So these are the conditions that we are assessing through your saliva sample. आपका जो 2 ml का saliva sample जो लेते हैं, उसमें एक प्रिजर्वेटिव डालते हैं, so that your DNA is not damaged till the time it's transported to the lab. And जब लैब में जाता है, there are very complex procedures. कई बार हम लोग ये सोचते हैं कि जैसे हम लोग पेपर डाल के जेरोक्स निकाल देते हैं, तो वैसे हम लोग ऐसा हमारा लार जो है वो मशीन में डाल देंगे और पूरा रिपोर्ट आ जाएगा. It is a very complex procedure of extracting your DNA, and then there are so many tests that have been done. उसके बाद में उसका raw genetic yield आ जाता है, and that yield or the data is been assessed by the bioinformatics team, who are well qualified, and उन्होंने बहुत सारे research papers को पढ़ के ये genetic mutation का क्या interpretation है इसको समझा है. Based on that we give the risk factors कि आपका risk बहुत high है या low है या moderate है. ये हम लोग आपको अलग अलग इमोजीज, कलरफुल इमोजीज के थ्रू हम लोग देते हैं, एंड दैट्स वेयर द रिपोर्ट बिकम्स वेरी वेरी crucial document of your life. So this is once in a lifetime test, and we want to quickly go with this background of कि क्या हम लोग करते हैं, because it probably covers almost all the phenotypes that we have. So I would like to request Riddhi, we have in the last 5 years done more than around 10,000, 10.5, 11,000 close to samples, and we have people right from 1.5 years to almost 95 years. So any range, age range के लोगों ने इसको टेस्टिंग किया है. Many of them out of desperation कि भाई एलोपैथिक ट्राई किया, होम्योपैथिक ट्राई किया, lot of पैथीज ट्राई किया, तो कुछ नहीं है तो चलो इसमें देख लेते हैं. A lot of people required specific insights. A lot of people also did out of curiosity कि भाई सब लोग कर रहे हैं तो चलो हम भी देखते हैं. But we have been able to achieve a lot of results. So I just want to throw a little light on some of the experiences that you have. So Riddhi, can you share some of the testimonies that you have, some case studies?
Yes, sir, sure. Am I clearly audible, sir?
Yes, you are.
Okay, great. So yeah, so it was a roller coaster ride for all of us, I guess. These 4 years, and it's still, I mean, it's touch wood, it's still going on very well. So some really amazing and awesome case studies that we have come across. I'll be talking in Hindi and English both,
should be fine.
so that everybody can understand. Yeah. So in 4 सालों में, like हमने इतने केसेस देखे हैं जिनको कोई बीमारी, कुछ ऐसे लोग भी थे जिनको कोई बीमारी नहीं थी, दे वर कंप्लीटली ऑल राइट एंड दे वांटेड टू ओनली प्रिवेंट. So I mean, I really appreciate that kind of a mindset because that is a very rare thing to see nowadays. Sadly, people wake up only after there is a problem in the body, right? But yeah, there were some people who came ahead and did the genetic testing, did the DNA test to understand for themselves कि अब उनको क्या करना है ताकि उनको जो भी रिस्क आए हैं रिपोर्ट में वो उनके नलिफाई कर सके या वो प्रिवेंट कर सके. Correct. And then there was another segment of people who sadly or unfortunately got the disease, and then they wanted to put a control on it, they wanted to manage it, they wanted to heal their body, and इसीलिए फिर उन्होंने डीएनए टेस्टिंग करवाया टू अंडरस्टैंड कि जो बीमारी से वो लड़ रहे हैं या जो बीमारी उनको अचानक से हुई है, एंड दे वर लाइक टेकन अबैक बाय दैट कि कभी भी मेरे फैमिली में ये चीज नहीं हुई है तो मुझे कैसे हो गई. सो उस चीज को हमने एक्सप्लेन किया उनको कि क्यों हुआ है ये. वो जीन शायद आपके बॉडी में ऑलरेडी प्रेजेंट था बट वो एक्सप्रेस नहीं हो पाया. सो दैट्स अ डिफरेंट थियोरी ऑल टुगेदर, दैट्स कॉल्ड जेनेटिक एक्सप्रेशन. एंड जेनेटिक एक्सप्रेशन ही आपको मतलब उसी पे निर्भर करता है कि आपको कौन सी बीमारी, जो बीमारी होने का रिस्क है वो होगी या नहीं होगी, राइट? और उसको आप कंट्रोल कर सकते हो, आप जीन्स को कंट्रोल नहीं कर सकते हैं क्योंकि जीन्स जो है वो आपको कंसेप्शन के टाइम से, जब आप कंसीव होते हो आपके माता के गर्भ में, तब से आपको मिल जाते हैं. बट ऑब्वियसली उसको आप बिल्कुल कंट्रोल नहीं कर सकते, पर उसके ऊपर एक एपिजेनेटिक कंट्रोल लाना बहुत जरूरी है. एपिजेनेटिक का मतलब है जेनेटिक के ऊपर, एपी का मतलब है ऊपर, सो दैट वर्ड मीन्स or an intervention which is over and above genetics. Yeah, so something which is there in your control, the key lies with you, but you're probably not aware of what to do, right? So वही हम काउंसल करते हैं पेशेंट को कि पहले हम उनका पूरा हिस्ट्री अंडरस्टैंड करते हैं. सो it always that's the time when the patient talks the most, so we understand what are the underlying issues. या सो क्या उसको कोई फिजिकल प्रॉब्लम है या फिर क्या उसको अंडरलाइन कोई इमोशनल हेल्थ इश्यू है, जैसे कि जैसे सर ने भी अभी कहा, एंड वी ऑल नो दैट stress is everywhere, correct? Even a child faces stress, yeah, maybe in the form of exams or school stress, bullying and whatnot. Yeah, so there's stress at every phase of your life. So इमोशनल हेल्थ को हम समझते हैं उनके फैमिली बैकग्राउंड को समझते हैं कि क्या रीजन हो सकता है कि मान लो अगर किसी के रिपोर्ट में आता है कि इनको कैंसर होने का रिस्क है या इनका ऑक्सीडेटिव स्ट्रेस लेवल बहुत हाई है, और अगर हमें इनको बचाना है कि वो बीमारी ना हो उनको, राइट? तो हमें वो अंडरस्टैंड करना पड़ेगा कि उनका खाने पीने की आदतें कैसी है, हाउ ऑफन डज ही एक्सरसाइज, इनके स्लीप पैटर्न्स कैसे है, इनका स्ट्रेस लेवल कितना है, right? So all those things come into picture, not just your diet patterns, correct? So it's a complete 360-degree approach wherein we also talk about your environment, your eating habits, exercising, stress management, sleep patterns, hydration levels, your emotional health, everything, right? So there was one case I would like to specifically talk about this, the first, because for me it was like a miracle, and when you see that picture you will also feel that is that a miracle, correct? So aap jab dekhoge ye photo, this was a classic case of alopecia areata. Yeah, so if you see on the left hand side on your screen, this is called a condition which is known as alopecia areata. Alopecia means hair loss, areata means specific पैचेस ऑफ हेयर लॉस. ओके, एरियाटा यानी कि एक एरिया से जा रहे हैं बाल. सो यूजुअली क्या होता है मेल्स में, दिस वाज अ 14-year-old बॉय, इनके केस में क्या हो रहा था कि आगे से बाल, ऑब्वियसली वो एज ही नहीं है बाल झड़ने की, बट इनको सिंस ये जेनेटिक इश्यू था तो आगे से रिसीड नहीं हो रही थी हेयरलाइन, एरियाज यानी कि पैचेस में, अलग अलग पैचेस में से बाल जा रहे थे. सो इफ यू सी देन पूरा इनका काउंसलिंग किया, इनका अंडरस्टैंड किया रिपोर्ट क्या है, इनका जेनेटिक फैमिली हिस्ट्री जानने के बाद मुझे जब हमने काउंसलिंग करी तब हमें रियलाइज हुआ कि इनके काफी थोड़ा सा स्ट्रेस लेवल भी था डेफिनेटली. एंड द मोस्ट इम्पॉर्टेंट फैक्टर हियर that came ahead, came in front through the genetic test, that was a mutation in the MTHFR gene. Yeah, so this gene basically controls a lot of functions in your body. MTHFR, right? Methylene tetrahydrofolate reductase. This is the gene which controls a lot of functions. अब क्या हुआ था इनके केस में मैं बताती हूँ. MTHFR के म्यूटेशन के कारण जो फॉलिकल्स है, हेयर फॉलिकल्स, राइट, जो रूट्स बोलते हैं ना हम, जो जड़ होती है बालों की, करेक्ट, उनको हम फॉलिकल्स कहते हैं. वो फॉलिकल्स जो है वो मैच्योर नहीं थे. सो वो ऑब्वियसली वो रूट पकड़ नहीं पाता है, करेक्ट, एंड दैट इज व्हाई देयर वाज अ हेयर लॉस इश्यू दैट हैपेंड ऑन हिज स्कैल्प, करेक्ट. व्हाट डिड वी डू? जो आप राइट साइड में देख रहे हो वो एक करिश्मा ही है एक्चुअली, बिकॉज ऑब्वियसली पुअर चाइल्ड, 14 साल का बच्चा है, स्कूल जाता है, and imagine the amount of stress and that emotional, you feel very low on self confidence when you have that kind of a issue, because skin और hair जो होते हैं ना वो हमारे aesthetics में आते हैं. Like we consider it to be as a part of your beauty or your looks or appearance, correct. अगर आपके बालों के साथ और आपकी skin के साथ कुछ होगा तो आप imagine कर सकते हो कि confidence की तो level क्या होगा बच्चे का, correct. So we also did some emotional counseling at that time, and we made him pledge actually, क्योंकि ये एज ऐसी है कि कोई कुछ फॉलो नहीं कर पाता है 100%, but this guy did it, and आप देख सकते हो कि उसका रिजल्ट क्या है, राइट, आपके सामने है. सो एलोपेशिया एरियाटा एक ऐसी प्रॉब्लम जो MTHFR म्यूटेशन के कारण होती है. MTHFR म्यूटेशन को ठीक करना ही इसका जवाब था, राइट. जैसे मैंने कहा MTHFR जीन को मैं कुछ नहीं कर पा रही हूँ क्योंकि वो तो ऑलरेडी है ना मेरे बॉडी में, आई कैन नॉट चेंज द जीन, बट हमने क्या किया कि उसको हमने जेनेटिक एक्सप्रेशन उसका चेंज किया. तो जेनेटिक एक्सप्रेशन किस तरह से चेंज करते हैं आप? बाय गिविंग अ नेचुरल सोर्स ऑफ फोलेट. फोलेट जो होता है विटामिन B9, right. Now there are two things here we need to keep in mind, and I'm specifically taking time on this case is because this MTHFR gene mutation is seen in most of the adults. Yeah, so ये इस रूप में भी सामने आ सकता है, कोई और रूप में भी सामने आता है, जैसे हार्ट अटैक. या सो MTHFR का जीन का म्यूटेशन हार्ट अटैक भी कॉज कर सकता है, which is the number one reason for deaths today, correct. So we did understand his background and all. Through nutrigenomics, through the science of nutrigenomics, we enable this expression of MTHFR through supplementing folate in his diet. उसकी diet में हमने folate rich foods बढ़ा दिए. Folate rich foods वो होते हैं जो leafy vegetables में पाए जाते हैं, fruits vegetables में पाए जाते हैं, अनाज में पाए जाते हैं. So with the help of correct eating patterns, this boy was able to gain a control over his genetic expression. करेक्ट. सेकेंडली उसको सप्लीमेंट भी दिया गया फोलेट का, बिकॉज ईटिंग पैटर्न्स आप समझ सकते हो कि एज के हिसाब से कैसे होते हैं. अब ये एज में ही हम ज्यादा ध्यान नहीं देते कि हमने टाइम टू टाइम खाया है या नहीं. तो इमेजिन अ स्कूल बॉय, ही विल मोस्ट ऑफ द टाइम्स गो फॉर जंक फूड, एंड उनके डाइट में था जंक फूड पैटर्न्स. सो वी गेव हिम अ सप्लीमेंट ऑफ फोलेट which helped him to control that hair loss issue, correct, the alopecia issue. And obviously body के अंदर बहुत सारी चीजें चेंज हो गई. उनके जो इन्फ्लेमेशन लेवल्स थे, इन्फ्लेमेशन लेवल्स भी बढ़ते हैं MTHFR म्यूटेशन के कारण, और दूसरे बहुत सारे रीजंस होते हैं. तो the highlight of this case was an MTHFR gene जो म्यूटेशन जिसमें पाया गया था. Secondly, इनका प्रोटीन इंटेक बढ़ाया गया. Yeah, so one was your vitamin B9, that is folate, in the natural form, not in a folic acid form. So there are two forms, one is folate and one is folic acid. So we cannot give a folic acid supplement to somebody who has a mutation in the MTHFR gene. So we gave him a natural folate, L-methyl folate उस फॉर्म का नाम है, तो वो सप्लीमेंट में पाया जाता है एंड नेचुरल फूड्स में पाया जाता है, राइट. प्रोटीन इनटेक बढ़ाया गया बिकॉज प्रोटीन, hair is a protein, right? So to encourage the growth of new hair, we gave him protein, right? Biotin is hair vitamin, right? So hair, skin, nails तीनों के लिए काम आता है बायोटिन. सप्लीमेंट फॉर्म में दिया गया था इनको क्योंकि डाइट में कम था. ही इज अ वेजिटेरियन, सो ज्यादातर एग्स में पाया जाता है बायोटिन, सो वो नहीं खा पा रहे थे, इसलिए हमने उसको सप्लीमेंट किया था. हाँ, डेफिनेटली नट्स एंड सीड्स में भी होता है एंड अ फ्यू अदर फूड्स एज वेल, बट वो रेयर थे, उनके डाइट में पॉसिबल नहीं था, इसलिए हमने उनको सप्लीमेंट दिया था. With combination of all these things in his diet and lifestyle, also a lot of counseling happened because as I told you that, you know, emotional health was at the least because this guy suffered from a lot of confidence issues. He was not even talking to us while on counseling, right? His parents were there on the call. So then, you know, we spoke to him and we counseled him ki everything will be fine and, you know, positivity thoda lana padta hai. So that's what happened and that changed the, you know, case actually.
Wonderful.
So
Riddhi,
a classic case of
how much
genetic
time
mutations.
it must have taken the whole, you know, the transformation from an
Yes.
alopecia, you know, victim to, I would say, and then to a normal handsome boy.
So that took a lot of time. See, because hair does not grow overnight. I mean, this quality hair does not grow overnight,
Yeah.
right? So it took around 1 year because that is when he sent the after pictures, and he said that ek saal ka to, matlab, we saw that time had. I mean, he needed
Okay,
that
so
much
now
time to
मेरा एक
recover.
सवाल है. I mean, all our people, participants must be wondering that इनका भी इतने बाल आ गए हैं, तो you know, hair thinning या जो hair जो जड़ते हैं, तो उसमें हमारा भी कुछ उम्मीद है, ऐसा करके लोगों को मन में ख्याल आता रहेगा. But I think we need to understand alopecia areata is a different condition than hair thinning or hair falling.
Different case.
So I think I want you to distinguish that also for people.
Yes, sir. So there are two types of thinning. When we talk about hair thinning, one is which happens in the case of males, that is called male pattern baldness, right? So that happens from the front, correct? Even in case of females, which is female pattern thinning or female pattern baldness, so that also happens from the temple region here, or it is in the crown, correct? So hair thinning will never happen in patches when you're talking about normal alopecia, correct? When it comes to alopecia areata, yes, it is an autoimmune, it is a kind of an autoimmune condition. It is caused because of inflammation, and it is caused because of because that person is living in a stressful condition all the time. Yeah, or he is not getting enough, his body, his cells are not recovering at the rate at which he should, they should, correct?
Absolutely.
So all these things are kept in mind while
Yeah,
making a
sure.
plan.
So Riddhi, the moral of the story in this testimony is that it's not really, doing a lot of expensive medications or procedures to get the desired result. It's actually trying to
Correct.
understand what the root cause is. कि इसकी जड़ क्या है, इसको पहले समझें, and that happens
Yeah.
through a genetic report, and then do necessary, accurate, precision solutions. It could be your dietary interventions, it could be your, clinical or rather, supplements, and just a few lifestyle changes. And very importantly, even the emotional part also is very important. A lot of people don't even take up the challenge simply because they're like given up even before they begin. So there is no hope.
Yeah.
And in medical world, the placebo effect plays a wonderful role as well. So of course, we'll see
Absolutely.
sometimes later. This is what it is. Now, I want you to speak a little on a very popular test that we do. हमारे ऐसे बहुत सारे सेमिनार 4 साल से जब भी होते आए हुए हैं. A few people, little very intelligent, smart people, यहाँ पे जो recommendation सुनते हैं, तो घर पे जाके वो चालू करते हैं without doing a genetic test. So a lot of people have actually stopped saying that हो सकता है कि मैं भी gluten intolerant हूँ. You don't have to do that if you're
Yeah.
not gluten intolerant. आप अपनी रोटी और मतलब जो भी है वो सब खा सकते हैं. But if there is a gluten intolerance, of course you need to find out. So 2-3 tests हैं which are food intolerance tests, which are very popular. क्योंकि खाने पीने की चीजों में हमारा ध्यान थोड़ा ज्यादा ही रहता है, and especially gluten intolerance, lactose intolerance, एंड कैफीन इंटॉलरेंस में जो लोगों की समझ अलग फिनोटाइप थोड़ा कभी कभी टेक्निकल रखते हैं वो ज्यादा है. सो what I want you to tell is that, you know, give me a few examples that you have counseled and got some results for your gluten intolerance or this kind of food intolerances.
One of them is sitting right in front of you, so it's me. So I'm intolerant to gluten, and I have completely given up now because I cannot digest it. As simple as that. So ऐसी चीजें खानी क्यों है जो आपको तकलीफ दे रही है, right? So one such case is me, and I had serious, tremendous acidity issues. I used to have frequent mouth ulcers. I used to think that ये तो B12 deficiency है, folate deficiency है, supplement खाया मैंने फिर भी वापस आ रहे हैं mouth ulcers. ये है क्या exactly? Right? So then I went to the underlying cause. I did the genetic report, and then I came to know, oh, this is the same old intolerance that is, you know, pestering me a lot. So I gave up on roti, my favorite, but then I had to. So I made rice my favorite now. So I'm happy.
Gujarati,
So
Gujarati
shift,
and
thoda
rice.
mental shift.
It's not a good combination, but that's where you need to make some dietary intervention. So I want
Yeah,
you to
we
speak.
need to. We need to. Absolutely.
Yeah, we need to. I mean, like, I want you to speak a little on the couple of testimonies that we have, where we have seen some very visible
Yes,
results.
yes, sure.
Little on this case.
Sure. So one of them is in front of you. That's a classic case of autoimmunity, which is brought about by gluten. Gluten is a protein. I'm sure all of you know that. It is found in wheat, correct? Now, not everybody will be, what do you say? Everybody will not get affected with gluten. So it's very very important to understand that जो इनके साथ हुआ है वो मेरे साथ भी वही results आएंगे. नहीं, ऐसा नहीं होता है. It's very very important to understand each individual as a different person, you know. So so yes, if you see on the left hand side before the genetic test, so this is a condition when there is, you know, a lot of abnormal skin growth, hyperkeratosis, yeah, of the nail. So there is keratin in your skin, correct, as well as hair and nails. So that is when there is overproduction of keratin protein, and obviously along with that there is some fungal infection as well that this person suffered from. So when I studied her case, and then when we all did a discussion, and then the first thing that came in her report was yes, she is a gluten intolerant. So we eliminated gluten from the diet. It took a lot of time, I believe, to counsel the patient, because her staple diet was wheat, you know. I mean, lunch, breakfast, lunch, dinner, तीनों में wheat था. तो बहुत मुश्किल था ये उनके डाइट से wheat को निकालना, गेहूं को निकालना. रोटी, पराठा, पूरी, ये सारी चीजें was very frequent in her diet. And but yes, where there is a will there is a way, we say, correct? So determination matters the most, and yes, she did it. So if you see on the right hand side, she was able to control that that autoimmunity that was happening. Yeah, and this person could have advanced to celiac disease also, huh? Let me tell you that. Because of the level of fungal infection that has happened there, the level of the body is attacking its own cells. So that's autoimmunity, correct? If you don't stop eating what is affecting you, what is not getting digested, अब वो आपको कैसे पता चलेगा? आपको genetic test से ही पता चलेगा, right? So you need to do a genetic test to understand the root cause, and once you come to know, you eliminate that, and that then it'll help you to recover. So the skin, then obviously the skin has started healing, and now she's recovering. If you see in the right hand side, completely all right. It's still there, but it's
We also have another condition,
and now she's completely
another
fine.
case like this.
Yeah, so the same. Correct. Hyperkeratosis of the nail, the toenail of the foot, correct? So ये नीचे भी एक nail है, ऊपर भी एक nail है, but दोनों inflamed है because of an intolerance.
Okay.
And that is why
Okay.
when you want to heal from inside, you need to eliminate the foods that are causing the
Perfect.
problem.
So now I want you to dwell a little on also on one other very popular results that we all talk about is the weight management. जब weight management की बात आती है, general perception हम सभी लोगों का ऐसा रहता है कि weight को कम करना है, weight को घटाना, because whether it's rural India or urban India, BMI today is a big problem, and people are overweight. 70% of India's urban population is overweight because of the wrong, food habits, and we don't really pay that much of an attention unless and until there is a serious medical condition. So I want you to speak of a case which I know of. I'm sure you can remember that. See that weight घटाने वाले बहुत सारे cases हैं. But tell me an incident where we have actually helped people or our patients to increase the weight. Weight को बढ़ाने के लिए आपने what are the testimonies that we may have?
Yeah. So one such case that was handled by Reena. I think a 10-year-old girl, 10-year-old girl, she was around 8 kgs underweight. Yeah. So as per her height and her age, and even when you look at her, she was like really very, very, very lean. Okay. So you call them as, I mean, in nutrition language, we call them as malnourished, correct? So malnourished thi and underweight thi. She was not having a good appetite कि भाई कुछ खाने दो तो भी she was to not accept the food, right? So fussy eater, 10-year-old, again the same issue of eating. You can't really be very strict with them कि ये तो खाना ही है, आपको बहुत प्यार से समझाना पड़ता है बच्चों को. So all that was done. Friend बनना पड़ता है उनका, because unless and until you be like them, they will not listen to you. They'll be like, who the hell are you? Yeah. So that's very, very important, correct? And
Yeah, so
yes,
the
आप अगर
resistance
देखो,
will
sorry to
definitely be
interrupt,
there.
sir. Yeah.
No, the
Sorry.
resistance will definitely be there because we have
Absolutely.
we have seen that genetics में ऐसे ऐसे insights मिलते हैं, तो sometimes people feel that नहीं नहीं ऐसा नहीं हो सकता है. So the patients or the customers themselves become counselors. मतलब कभी कभी रिवर्स काउंसलिंग हो जाता है. हमारे पेशेंट्स इतने अच्छे हैं कि हमारे काउंसलर्स को ज्ञान देते रहते हैं कि भाई मतलब ऐसा नहीं है, ऐसा है. So we have to really work hard with them and उनको समझाना पड़ता है कि भाई ये जेनेटिक रिपोर्ट आपका सलाइवा सैंपल का है, मेरा नहीं है. So then we'll have to explain to them.
Correct.
So sometimes people do questions that. Yeah, so I think that's a wonderful case. When it comes to
So she
weight,
gained around so before I go to this, I want to share that what I mean her achievements. So that girl,
please.
she gained around 3 kgs in 2 months, and that has never happened in 7 years. Her mom said, So now she's very confident girl, and now she's living her life, the best of her life now.
Yeah, and
Yeah,
I do.
and obviously, yes, sir.
I do remember Riddhi that their father and I mean like their parents, father and mother, they all come from pharma background, so they were well aware of genetic tests or the food diet interventions that they're doing, a lot of supplements. So they've been trying a lot of things for 7 years, but it was they were not able to actually increase the weight. And in this case, meticulous study based on a genetic report and then precision interventions actually could help her, gain weight. So of course, there are some many,
So
many
as
examples.
simple as something as simple as understanding the effect of fat that it will have on your body is very, very important. Her satiety levels had to be checked, in which is there in our report. So her satiety was worked on her because her appetite was a big issue. Yeah, she couldn't eat only beyond a certain point of time. Itna kha ke then she was full. So then we had to open up her appetite. Then she then there was protein ka jo metabolism hota hai. All those things had to be kept in mind. So macronutrient ratio is very, very important when we talk about weight management. Macronutrient यानी कि carbohydrate, proteins and fats, ये तीनों का बहुत योगदान होता है आपके weight में, because ये तीनों बड़े पैमाने पे काम करते हैं आपके body में, at a very bigger level, correct?
All right.
So vitamins, minerals जो होते हैं वो micro होते हैं, so that's a support. Yes.
Yeah, so quickly, let's move on. I think we've got a few minutes more. So, these are some of the testimonies that we have seen in weight management. So, जब weight आपका कम हो जाता है, as per the BMI, your fat content comes down, your protein intake goes up, the carbohydrates come down. So, all that trial and error में या elimination method में नहीं, but we are giving a gene-based diet plan, which is a precision, solution. तो आपको वो ज़्यादा accurate रखता है. It's like, you're hitting the bull's eye उसमें ट्रायल एंड एरर मेथड के जो चांसेस है उसको एलिमिनेट किया जाता है. So these are some of the testimonies that we have. You will see some of the people who look much younger. In fact, I'm sure Vipul Agarwal is here. So he, shedding a lot of weight, he has bought a cycle and he's going for all these cycle races, and then he runs marathon races of 20 kilometers and 50 kilometers. And I'm wondering, how does he do that? And then, his stamina has increased because of he has gained that fitness. So he shares with us, and in one of the events last week, I guess last month, Kargil Martyrs का जो विजय दिवस था, where Velocity Booster was one of the hydration partner. So he actually ran that race, and then he is so active in that. So it actually increases your physical fitness. Now, for the people who are, attending this webinar for the first time, well, that's me before and after. And I could make a transformation in my weight, and people said, I looked a little younger. In just around 4 weeks' time, I lost around 12 kgs just by changing the diet. And my diet was done by Reena Baliga. She's also our other genetic counselor. She's probably she's present. So this is something that happened. So weight management ke bahut sare cases hain. It's easy, honestly speaking. Just follow 60-70% of the diet recommendation that are given. And I didn't make much changes. I still was eating the same food that I was consuming earlier, but thoda portion size change hua, timing change hua. I probably put in a few things that I was missing. Like, I started eating a lot of sprouts, which gave me a lot of protein and energy, and then I never felt hungry, and then I was still consuming. I'm a South Indian, and I'm eating a lot of rice, so I still continue to eat rice. And of course, now I have that confidence that yes, this is my range of food. Okay, what are the do's and don'ts? So this is what we have. Riddhi, I want you to throw light on one of the other major problems apart from diabetes. Of course, diabetes के भी बहुत अच्छे results हैं. Is hypertension. So what do you have to say about hypertension, and what has been your experience?
One of our clients, no, I mean, he's one of those who was successfully able to, reduce his dosage to, and then ultimately the doctor stopped his medication. So that's a very, very good case of, eating as per your genes. Yeah. So if you eat as per your genes, you'll never have to depend on medications. Trust me, because your body gets what it wants, right? Your body is healing from inside. There's nobody, I mean, more happier than your body, correct? So if you allow your body to heal by itself, because that's the, I mean, it's वो तो पहले से ही है ना, आपकी बॉडी को वो मिला हुआ है कि हीलिंग मैकेनिज्म तो दिया है भगवान ने, राइट? पर हम उसको फिर क्या करते हैं ना कि वी डोंट हील आवर बॉडी. तो मेडिकेशन से वी ट्रीट द प्रॉब्लम, राइट? बट जबकि करना ये है कि मेन रूट कॉज समझ के उसको हील करना है, उसको सॉल्व करना है. सो दैट्स व्हाट हाइपरटेंशन का एक केस था जिनके मेडिकेशन स्टॉप हो गए. ही आल्सो हैड अ प्रॉब्लम विथ हिज ईयर. देयर इज अ प्रॉब्लम कॉल्ड एज टिनिटस. या सो टिनिटस में क्या होता है कि देयर इज अ रिंगिंग साउंड दैट कम्स इन द ईयर. Yeah, so there's no perforation of the eardrum or anything. It's just some kind of an infection that has happened, and recurring infection. So there's a sound that comes from the ear, and he had this problem, and it had really been a very severe problem of tinnitus. But then he also was gluten intolerant. After stopping gluten, a lot of inflammation came down, a lot of tissues healed, and that is how he was able to recover from tinnitus also. Okay, so hypertension and tinnitus both. Yeah.
Sure. So thank you, Reena. I think this is a little, trying to understand कि क्या छोटे-छोटे dietary interventions हैं, small lifestyle changes हैं, या क्या ये छोटे-छोटे factors हैं that matter in we experiencing good health. And we are now aware कि adverse drug reaction is one of the major killers. There are books written by medical doctors to explain कि इसके क्या side effects हैं. Does that mean that you should not go to the doctor or you should not eat medicine? Not at all. Don't get a wrong message. आपको डॉक्टर के पास जाना है, आपका मेडिकल कंडीशन को एक्सप्लेन करना है, and you have to take proper medication because you have crossed that stage where all these things probably could be able to handle all your solutions all alone. So you need also medical support. But the qualified health practitioner, the doctors, or irrespective of what therapy that you're practicing, they will advise you based on your other medical parameters, saying that maybe now you need to reduce your dosage, or one day probably you need to stop completely the medication because it's not required. So this is something that we can do. We had a few people asking a couple of questions. So Riddhi, if you could go through, I'd like
Yes,
to
sir.
acknowledge Marita Pereira from Abu Dhabi, who is presenting this, and then she's got wonderful results with her weight and fitness. Dr. Anjali Jadhav from Thane, Maharashtra, thank you for acknowledging that you've got wonderful results, not for yourself, but for the entire family. Sunil Yadav, thank you for expressing. And I'd like to go to GR Krishna, if you are able to put your video on, and you want to share something. You've been sharing a lot of things and giving us very good insights with your vast experience of working with the athletes and working in the field of nutrition. So you probably can come back. So anybody would like to share or would like to ask any questions, you probably could ask that. So Mr. Krishna, you want to unmute and ask that question rather than typing?
No, I just wanted to commend Madam Riddhi Shah that she, not many people realize that there is a very strong connection between tendinitis and hypertension.
Yeah.
What a very good point. I'm impressed.
Thank you.
Yes, sir. Absolutely. Thank you so much.
Tonight. Thank you.
Mr. Krishna also had a suggestion for you, Riddhi, saying if you're not able to get along with gluten, try besan.
Yeah, sure. I'm not very fond of besan, so rice is my savior. Yeah.
All right.
That is funny. Anyway.
All right. So anybody would like to share? Thank you, Mr. Krishna. It's been wonderful interacting with you, and I had the privilege to meet you personally as well down south in Bengaluru when I came down. So Dr. Vasanta Nair is here with us. You want to ask a question, Dr. Nair? So I can unmute you, and you probably could ask your question as well, if you want to share, or anybody would like to share anything. Or want to ask a question. So Riddhi, could you please check in the chat and then answer some of the questions that people had?
Yeah.
So Dr. Dominic Lobo asked a very fundamental question as to what's the cause of malnutrition?
In that girl's case, right? So
no,
it was
in general, I guess.
Okay. I thought he's asking for that girl.
Possibly.
So malnutrition. Yeah, malnutrition can be because of a lot of issues. I mean, because of a lot of underlying causes. One is when the person does not eat only. Yeah. So the first thing is that he does not have a good appetite. Correct. Secondly, if he's not, if he's not very, if his internal environment is such that absorption does not take place effectively. So, aap kha to rahe ho, you're eating food on time, you're eating the right kind of food, but there's an underlying issue with you, which means that your body can either not absorb it, or if there is an intolerance, your body cannot absorb it because it affects the small intestine. Yeah, so lactose intolerance and gluten intolerance both affect your small intestine. Secondly, there are nutritional deficiencies that can further aggravate malnutrition. So there is something called as, if you are aware of B12 deficiency, which is the most common of all, correct? Vitamin D deficiency can also further cause a lot of issues. Protein energy malnutrition. So that's the case that we were discussing. So we supplemented her diet. I mean, we prescribed her a diet which was rich in protein and calories both, but not fat. Okay, so we only gave her healthy fats as a part of the diet. Healthy fats are the omega fats that we usually talk about in our sessions. So there's a difference between saturated fats and your healthy fats, unsaturated, correct?
Okay.
So knowing the quality of fat is very, very important when you're gaining weight. Yeah.
Okay, so Dr. Vasanta is asking a question on the chat. So for weight reduction along with change diet, did you have to exercise or you lost weight irrespective of walks and exercise? I can guess where that question coming from. Yeah, because people, in general are a little reluctant to do physical activities because it's a little straining. You'll have to go out of your comfort zone. So we would like to probably have it otherwise. In my case, I would say the answer was no, because I didn't hit the gym. I was doing, regular, I used to still drive sitting 1.5 hours to the office. So I didn't do extraordinary, exercise at all. But and after I lost weight, I thought probably, I'm getting better. I'm feeling more energetic and younger. So then I said, probably, I think we need to go to a gym because I did start that. But my weight loss did not happen because of gym activities, but it helped at the later part. So I started losing weight just in the first week. My waist inches came down, and then it was really amazing experience. I actually could not believe that it's happening, and I could just make some smart changes that were suggested in the diet plan. Okay, great. So when it comes to diet, a lot of it is cultural, and that's true, Mr. Krishna, because I think the diet that you would have in Kerala and in Punjab and in Bengal is drastically different. India is state of countries. It's not a country of states. It's a state of countries. I've seen people eating one type of food and then not eating. I've got my friend Lakshman from Bangalore. I was in Bangalore the other day. The portion size of biryani there is like, in Mumbai, probably 5 people will eat one biryani. But there, people still eat that, and then they still don't put on weight, simply because I think the genetics and the cultural aspects of not just the genetics, but so many other things are completely different. So I completely agree with that, and we have this. So friends, I actually want to tell you this, that एक ज़माना था जब we had a 2G phone with us. वो 2G phone में screen नहीं था, you didn't have a lot of apps, and then slowly there was a next generation technology that came in, and then we upgraded ourselves to 3G. From 3G, we graduated to 4G, and today now we are looking at 5G. And I'm sure if you are not with the time, आप थोड़ा सा irrelevant or outdated लगेंगे, because you will feel that you are not there. You are not at the forefront of the technology. Now, there is technology upgrading in telecommunications, in your banking, in your education, every area. So does that mean that it's not, encompassing the health sector? Of course, there are a lot of technologies that are coming in. The future tomorrow is that the blood-based diagnosis probably will not exist. There are predictions now, and it might sound very weird when I say this, that you will actually have a small microchip somewhere inserted in your body, and that will give all the vital parameters in your smartphone, saying that this is your temperature, this is your hypertension level, this is your pulse rate, and this is your, probably all kinds of bioinformatics that we otherwise would get through a very expensive thing. So that precisely also means that, you probably could have another person sharing that with, and in the case of emergency, that also could send alerts. So technology हमारे health में बहुत ज़्यादा आई है. We hear that robots today are doing surgeries from one country. The robot is there and the patient is sitting in another continent. ये भी हो रहा है. इसका मतलब ये नहीं कि we'll only now wait for that kind of a condition. There are very expensive treatments and therapies right now, but we have an opportunity to make small changes on your day-to-day basis. Whether it's the waking time or sleeping time. The social media आने से काफी तकलीफ हुई है. People are good morning बोल के सो जाते हैं. They are on social media. On Twitter and Facebook and all kinds of Instagram and everything, till around 1 o'clock, 2 o'clock. WhatsApp में कई बार हम लोग ये देखते हैं कि sleeping time क्या है लोगों का, last scene वो देखते हैं, तो people, we feel that people are overworking. So this all is going to have a lot of impact, and it's our nutrition that needs to be taken care of. And nutrigenomics is one segment of genetic testing. Then epigenetics is another segment where we need to making a lot of smart changes. And then of course comes the Ayurgenomics and pharmacogenomics. And I'm sure all these aspects will help not just the health conscious individual, but also the medical fraternity to do change the line of treatment in such a way that the results could be faster. Now, one of the doctors actually told me, saying that you all are educating, लोगों को आप इतना educate कर रहे हैं कि लोग अभी सही तरीके से खाना खाएंगे, उनको बीमारी नहीं आएगी, तो हमारा धंधा चौपट हो जाएगा. So I want to tell all the medical doctors that is not going to be the case. So simply because assuming there are risk factors that we are telling people that कि आपको ये risk factors है, we also advise them to constantly monitor their test through various other blood-based tests. The fundamental difference between a genetic test and a blood-based test is genetic test tells you what's going to happen throughout your lifetime. It's once in a lifetime technology, once in a lifetime span ka technology hai. But blood-based technology, all your diagnostic tests today are going to tell you what's your condition right now. So you need to constantly monitor. So I feel that doing genetic testing, there's more business that's revenue that's generated to the medical doctors as well. And people will then get into a lot of other dimensions of wellness, whether it's fitness and dietary supplements, or whether it is being today we got this Fitbits and smart watches and everything. So people are consuming and buying more of this durables and also consumables. So our business is definitely be going up. So my last recommendation to people is that Zoom में आके थियरी सुन के आप डाइटरी इंटरवेंशन स्टार्ट ना करें. हैव द I would say courtesy to actually do a genetic testing of yourself. It needs to be done only once, and that will give you insights that are valid for lifetime, because you can change everything, but not your biological father and mother. They still remain the same. So that means आपका genetic material जो आपके शरीर में है उसको आप चेंज नहीं कर सकते हैं, लेकिन उसका एक्सप्रेशन को आप डेफिनेटली चेंज कर सकते हैं. तो वो एक्सप्रेशन को स्विच ऑन कैसे करना या स्विच ऑफ कैसे करना, इसकी अगर हम लोगों को जानकारी मिलेगी, we'll get some really good insights, and I'm going to be I'm sure it's going to be really helpful. So friends, thank you very much. This was a little intervention, discussion based on a few testimonies that we have had. We've got loads of testimonies, hundreds of testimonies that you can see some of the videos on our YouTube channel as well. And thank you, Riddhi, for sharing your valuable information. And thank you, everybody, for acknowledging the contribution Velocity Genetics is doing to help people to live healthier by unlocking their genetic potential. So till the next discussion, stay healthy, stay focused with whatever you're doing, be positive and be enthusiastic, and produce a lot of results in your life. So thank you very much.
Thank you, sir. Thank you so much for this lovely session.
Yeah. So let's have a nutritious dinner, sleep well on time. So thank you very much. Goodbye. Let's have, we have another session on alkaline water on Friday, which is at 8 o'clock. So stay back, stay focused, and then tune in for that webinar as well. So thank you very much. Goodbye and good night.